Peter.
Three.
But can you also give them creative names, not just wife?
Actually, we should.
Yes.
He may have played a lot, but depends on also if it resonates. You may say Dumato, but nobody else knows him.
Except Lutu.
Catherine, are you ready?
To this event, this is really one of the steps towards us having in place a fully functional radiation oncology capacity in the country. For a long time, we have been having one linear accelerator. Now we have additional 2. So that means actually our capacity has increased tremendously. For a couple of weeks now, we have been having on the ground experts from the manufacturer and the supplier of the equipment. That is Varian. They have been helping us to set up the equipment. Now we are ready to start. But this is not yet the final steps. This is just now to start dry run of the equipment by using it on real patients. In essence, actually, patients are being treated. But after doing this, then we are going to be applying now for the license from the Atomic Energy Council. And it is after we have got the license from the Atomic Energy Council that we will say now we are actually fully fledged licensed radiation oncology unit to treat patients. So take it that this is still part of our dry run, but a very serious one in that patients are really being treated. Dr. Lutu, together with this team, CC and the others,
Starting to use the state-of-the-art equipment, which we've promised Ugandans for a long time. But time has come that we are indeed here. This machine, people have been trained to use it, so Ugandans shouldn't worry that the people lack the knowledge. People have been trained, and we've gone through a rigorous exercise of making sure that these machines are safe for patient use. And as we speak now, like the ED said, for the dry run, we've so far treated 3, and we are waiting for the 4th. It is unfortunate you can't see this, but the 4th patient is going to get the state-of-the-art technique, which is called VMAT, as you can see that arc all around the patient. So we are really very delighted. And I will request Madame Sisse, because she spent the whole day.
Backlog of 142 patients. That was at the beginning of this month. Last week, Thursday, Friday, we called them in, and as they are reporting, we are scheduling them to begin treatment. Which means with the additional 2 machines that we have received and started using, our backlog will not be there. So as you're called in, you come, report, start treatment. And the treatment is not a one-day treatment. We treat someone for a month and a half, roughly 30-35 working days. Yes.
Which type of cancers do you treat?
We treat every type of cancer, from skin cancers to deeply seated cancers, as long as it's on your body. So we treat every type of cancer, be it on the head, in the chest, in the pelvis, in the abdomen, on the legs. We treat every type of cancer.
So you mean the patients, the 100?
The 140 patients, they all have different types of cancer, and they are all beginning treatment today and tomorrow and Wednesday. Children, we have all sexes, male and female, and also the children. The children comprise of 20% of our cancer population. So even as children, as they come, we treat them.
Do you have foreigners or the Ugandans?
No, the number of foreigners has increased since we acquired the first machine. So, and it's on the increase. Currently, we have 3 foreigners in-house that are receiving treatment on the different machines.
Which type of cancer?
Prostate cancer, cervical cancer, head and neck cancers.
Breast.
We have a variety of cancers.
Okay. Is that the truth?
So what exactly do you need?
We prefer you go down the side for
Yeah.
You can explain, maybe for recorder.
And where we are today, the place is called the bunker, not where money is stored, but bunker. It is a very thick, reinforced concrete area. And what we are seeing, this is the ED, and then the contracts manager and the team who are going to be operating this machine. As you see the name, it's a true beam linear accelerator, state-of-the-art machine, which has gone through all the entire process of being used to safely deliver radiation to the patients, to treat and cure, in some cases, cancer. So it's a true beam, really not seen in many African countries. I think this could be the only center in sub-Saharan Africa to have three true beam machines.
To have 3 machines together,
Yes.
that is a very big achievement.
As you may get to know, the process is much longer than what we have explained. One needs to plan, just doesn't wake up and say, no, let us bring this to be in here. No, it takes a very long time to plan for it. And I think, Dr. Riem, you let us know which tree was here.
Oh,
The forest.
there was a forest with monkeys.
Yes.
Now.
So that's where we are. It's now looks very nice. So thank you very much.
It's the same. It's supposed to be A, eh? Yes, please. She's here.
Treating all sorts of cancers with precision. That's a very important thing, is that with precision, we treat the cancer according to the size and according to the shape and according to the location where the cancer is, which we use precisely. Like what would be done in the US or in the UK or any other place in India or wherever. So we are really very delighted. So for the press, I think you are counting, this is number 2. So we are going to say number 3. They may be looking the same, but they are different. Yep.
Confirm the patient's credentials, their age, their names, full names, so that we do not treat the same patients with the different plans. So at the consult, the room we just bypassed, we have to confirm that I'm treating Miss Nakaganda, and I'm not treating Miss Prosi Nakaganda. And when you come in, you lie on this table. The table has to be low. We position you using the lasers. The greens are there on the walls. We use the greens to position. Irrespective of which part we are treating, this table will always be at a height, which is here. So we must remember to remind someone that you're going to lie here for around 3 to 4 minutes. We request you not to move, not to scratch yourself. Reason being, we want them there, and also talk to them. When we begin treatment, when we initiate treatment, this machine will be moving around the patient in that motion. And most importantly, we tell the patient that this patient can go home. The patient spends around 10 minutes in this room on a daily basis. And we also take images, x-rays, and also a CT scan. We take x-rays. Rarely we treat you for 1 day. If we are intending to cure you, we treat you.
Does the patient have to go through the same process?
Yes.
Whenever
The whole principle behind is that you've got a mass of cancer cells. So you keep on doing every day, until you clear all the cancer cells. That's the principle behind it. So every day we do. But it's very important to get to know how fascinating this machine is. It's a linear, treats cancer using X-rays and electrons. So it is 4 in 1. Very amazing. Very amazing.
Doctor, does this...
Like even aspirin, when you take aspirin, you get some irritation of the stomach. So there are side effects, but minimized, very minimized, because it is precise to the cancer itself. So the surrounding normal tissues are spared compared to the older techniques. Yep.
For instance, you were hearing the one that broke down some time ago,
Yes.
that was old technology, and the side effects with that machine was more. This machine reduces the side effects that patient used to receive with that machine almost to less than 5%.
And that's why we believe in the next couple of years, there is a word which is going to disappear in our language of, I'm going to be bad. It was because of the old technology. But I think in the next few years, that word won't be there. We may use another word, I'm going to be treated.
Exactly.
I think something like that.
This machine, when you are inside here, you will not feel anything. So the treatment is painless. You cannot sense it. You cannot sense heat. You cannot not even smell it. You cannot see it. So the only thing you realize is that, something has already happened. And in most cases, since we are targeting the cancer, it has happened to the cancer, but it has spared the normal system, the normal organs, etc.
Doctor, that was a machine moves non-stop around. Doesn't have any complaint, doesn't have anything. The skin is as intact as any other person's skin. And it's only...
So we go and see the first one, because they may say that, oh no, we have shown them.
Solomon, can you get a
Thing is, as you see, we have three equipments. So that means for all the three to break down at the same time is going to be unlikely. So that means we have a backup plan. So if one breaks down or one is being maintained, the other two are working. So that is already one strategy. And then the second strategy that we have is that we have a contract with the manufacturers of this equipment, and our what do we call it? We have a what do you call? We have service contract. That's the right word. That runs for each of them runs for 5 years, and those service contracts, when they expire, we can still negotiate with them so that it is extended.
How about the number of experts that you have who can operate? Are we trained them?
That is what I've just been saying. That we have almost how many senior experts? We have more than 5 senior experts. We have already started training programs also locally. We have even got students coming from now Malawi, who have joined us. They are training with our own locally here. So that means we have the capacity. Now we have graduated from just the capacity of our people who have been trained from outside to now the capacity of training locally for ourselves and also for others. After we have completed what we are doing here, this dry run, then we shall now send our application to the Atomic Energy Council to give us the license. And that is now going to be what we call the technical commissioning of the equipment.
What does it mean exactly? What should we have done so that we can attain that license?
We should be able to pick all the information or all the data regarding the people we are treating, including things like, are there any side effects? Anything went wrong during the treatment? What about the dosage? Has there been any variation in that? We compile all that and then we submit to them.
I'm Mr. Vincent Intege. I'm a retired civil servant.
Okay, you can speak English.
Yeah. I can speak English.
You can speak English.
I'm Vincent Intege. I was working for government before in the Ministry of Finance, and I was also head of planning in the Ministry of Gender, Labour and Social Development, but I retired some time back. This is quite a long time back. Then I worked with the Uganda National Farmers Federation for some time. So I've been working with farmers, working on these saving groups and whatnot and whatnot. Now, in 2018, I was diagnosed for prostate cancer, and it had gone quite far, almost at the stage. And a lot of things were said. They said, Then I got a doctor, Dr. Okuku, who is an oncologist here, but he had a private practice, and he put me on a system which is called hormonal therapy for almost 2 years. Treating this. I also had diabetes, so it was a combination. It was a bit complicated, but I thank these doctors for their expertise. So after some time, my thing was reading very, very high, almost 40 something in their cancer. But it has been to be reduced to 0 before I can go for radiation. So during that period, I was getting a 3-month monthly injection, which brought it to 0. Then that was the time. That was 2019, 2020-ish, yeah? And these machines were being installed here, but they were not ready. And even the people were training. I was told they were training in Israel or something like that. So the doctor said that my progress was so good that they requested me to volunteer to be one of the people to when these machines were going to open, to be one of the patients. But it delayed a bit because of the COVID. The doctors from Israel, from where they were not coming. Then eventually they came. Then they told me, said, you are going to be one of these people. We were 6 people. This building was still being renovated, put in place, but the machine was there. So they told me to come. I don't know, I was thinking, but I thank the government because after that thing, I was supposed to go to India and have that radiation, which is very, very expensive, you see. Those who have been to India, to any other country, anywhere, for that kind of process. Yes. So they said, no, this machine is good. And they were assured by the director of the hospital here that said, these machines, we have installed them. Don't worry, you are new. So I went there with one heart. But of course, as you said when you were going to interview me, God is great. So we were also praying, said, we shall go. I'll do it. So we were 6 people with different types of cancers. I had some other gentlemen old my age who had the same problem like mine. Then we had a lady, a girl, who had cancer of the brain. Then there was, I think, an Indian lady who had cancer, I don't know, the spine or something. So we were about 6 people, and we went into it. I had 33 sessions here, and we had to come every day, very, very early in the morning, so that because by 9 they had to go and assess what was going on. So we went on. The doctors were very good, and I thank the staff here. Dr. Ruto was in charge of those doctors. There was a lady Sise, and that it was okay. That's what they told me. But they said that they had to follow me up. So they gave me some 3 months to come and follow me up. And then I came back after 3 months. Then I came back after 3 months. Now, after that, I thought everything was okay. I didn't come back. Now, little did I know that my wife would also get cancer. And she's getting treatment here now. So,
Which type of cancer?
she had uterine cancer, something to do with it.